You're listening to the uMentor talk show, now available on the Umoja app. I'm your host, Imran Ramsey, and on this weekly talk show, we invite professionals and teenagers to take us through their journeys and give us advice. We took a break for about 2 weeks, but now we are happy to be back. And remember, if you have any questions for the panelists that we have on this show, you can always leave them on the Inspire app, or you can connect with them. And in today's case, you can connect with our speaker on LinkedIn, and the link is right there in the ticker. So before we start, we wanted to mention a bit about the Inspire platform. And this is a new question and answer platform for career advice in our Shia community. So as a rising professional, you can ask for advice from other professionals in our community. And as a mentor, you can give advice to future professionals and students who might be younger than you. So that's available via the Umoja app with an Umoja account, which is free on Android and iOS. So we hope you download that. We have some great mentors, and we hope that you become a mentor as well. And just one quick thing, we are able to share stories of inspiring professionals, students, and community organizations only because of the support of generous viewers and listeners like you. So we ask you to please consider supporting our show. You can support at umojaoutreach.org/donate, or at the in the Umoja app. You can click the donate option. And again, every little bit does go a really long way in opening career doors for our youth and connecting our communities. So we thank you for that. And now let's get on to today's speaker. So today on the show, we have Brother Hussain Naqvi. And he is a third-year student at the University of Waterloo. As it says there, he's an aspiring physician. He currently has publications on dementia, telemedicine, and the integrative healthcare system in Ontario. He also has experience working with the Canadian government on multiple levels, in roles that include health policy analysis, health research, health data, and system-level decision-making. So he'll talk to us more about that, I'm sure. Currently, he is also working with a team of medical experts, students, and researchers in designing new 3D medical technologies, which sounds very cool. So there's a lot to talk about. And I hope that you will also, after the show, connect with him on LinkedIn, because his LinkedIn is right there in the ticker. So let's bring on Brother Hussain.
How are you,
Assalamu
alaikum. How are
Good.
you?
How are you? Thank you for joining us. I'm doing well. We planned around a little bit of unexpected events, but thank you for, still being here and coming on the show.
Certainly.
So I guess I did a little bit of an introduction already, but there is definitely a lot that you do, a lot of stuff. You've done a lot. You've had a lot of co-op experiences. So just kind of talk a little bit about yourself. Who are you, and how did you get interested in the field that you are in right now?
Well, to be fair, I think as far as my interest in the field goes, or as far as some of the work I do, I think a lot of that has been supported primarily by some of the opportunities that I've had in school, which include co-op, or which include, counseling and support from my professors and other people and my mentors in the university itself. I think with any field, an interest particularly develops sort of the more you do it. So for me, coming out of high school, I didn't really have much of an interest towards medicine. I didn't really have much of an interest towards anything.
Okay.
I was very undecided.
Got it.
And then later on, I'd say when I got to university, and when I interacted with people, when I interacted with professionals, when I interacted with these professors, I saw that there was so much more to what medicine and what healthcare is than what we've traditionally drummed it up to be. And from there,
sorry, what do you mean by that? I feel like a lot of people do say that, but in your case, what did you discover that was, I guess, more than you had initially thought?
Well, normally when you think of a doctor, you think of someone who walks around in a medical clinic with a stethoscope around their neck, and they're going and they're putting it on your heart and they're doing an examination. Yeah. Typically, that's what we think of doctors as. And that's what we typically think the healthcare system does in general. But in reality, there's so much more to it. The vast majority of medical conditions and the vast majority of health conditions are actually determined outside of the clinic, not inside of it. And that's where you have things such as health policy or economic policy and political policy and social policies that influence how various patients respond, not just to healthcare treatments, but also to the diseases that they're, more vulnerable to, or the diseases that have a higher prevalence in X, Y, or Z communities. And on top of that, now in the 21st century, now we actually have so much more health data. We have health technology,
Right.
we have health AI, and there's so much more that's really happening. And I think at the University of Waterloo, when I at least went in, and when I met a lot of these people, that's when I started to really understand that there's so much more to medicine than what traditionally
Right.
meets the eye. And I think
Mm-hmm.
just getting that exposure and getting that broadening of like my perspective really supported I think that's really what helped curate my interest in this field altogether. And then
Yeah.
sort of the more you do it, the more you learn and the better you get and the more interest you
Right.
get.
Yeah, as with any fields. But so
Yeah.
thank you for sharing that. Now, I know we were talking about this. At some universities, you do have to declare your major, or at least what kind of thing you'll be studying as soon as you get there.
Yeah.
And I know you had mentioned that you were undecided. So how did you, I guess, work with that? How did you make the decision to say, okay, I'm gonna do, um, you know, like I'm gonna go on the pre-med path, and I've decided that because it's pretty hard to change, is what you were telling
Yeah,
me.
it is. It's very hard to change. I mean, not
Yeah,
that it's impossible, but it, tax on a few
sure.
years. Um,
Yeah,
for me,
that's a
really,
lot.
I was undecided.
That's a lot.
Yeah, and
Yeah.
to be fair, I was sort of undecided, and then my parents sort of supported me, and they're like, "Hey, you're strong at biology, you're strong at chemistry. Just go into this. If you like it, stick with it. If you don't, change it." And I think coming out of high school, for anyone, not just myself in particular, I think for a lot of people, there is a lot of ambiguity. There's a lot of indecisiveness as to what you want to do for the rest of your life, because it is a fairly big decision.
Yeah.
And I think then, speaking to as many people as you can and understanding as many perspectives as you can really helps you better understand what it is that you want to do. And I think in my case, that's exactly what happened. And then once you actually start doing something, you figure out, do I like it? Do I not like it? And then you can make your decision, as to whether you want to continue it. Then, fortunately, in my case, I ended up liking it. In fact, I loved it. And I do it to this very day.
Great. Um, Now, what is your actual major? Because I know pre-med is not a major.
Well, I'm doing health systems.
Health systems. What is that?
Yes. So basically, it's sort of like a hybrid, you could say, between health science and public health. So we
Okay.
take a lot of like science courses, a lot of like human biochem courses, chemistry courses, biology courses. And then that's like, you could say that's like 50% of our degree. And the other 50% is
Yeah.
public health. So public health policies,
Okay.
social determinants, epidemiology, health informatics, these kinds of things. So it's really just a
Got it.
hybrid. I'd say.
So I know some of our listeners, like they might be hearing a lot of these words for the first time. So could you give us, I guess, a little bit of a crash course into, I know you're specifically interested in health information technology, which is a part of both public health and medicine. So
Yes.
what is public health? What is the difference between public health and medicine? And then what's health IT?
Well, okay, so let's start in order. I'd say medicine
Yeah.
is, let's say, you go into a clinic, you receive medical services, whether that's blood work, whether that's a diagnosis, whether that's a treatment from a medical practitioner. That's what medicine is. Public
Okay.
health
Yeah.
focuses on the structure, it focuses on the system of public health. So, for example, and public health largely focuses on what happens outside of a clinic. For example, one of the biggest issues we're seeing now with an aging population is, let's say, cardiac diseases. There's a lot of cardiac diseases now, particularly with our aging populations. And one of the largest precursors to that is public health, is obesity. So from a medical point of view, if there's a patient who comes in with a cardiac issue, you do an ECG, you do all of your testing, then you devise a treatment plan, you give them medicines, you give them exercises to do, you refer them to a specialist. That's medicine. Public health focuses on more so the whole system or the bigger picture. So public health would be like, okay, this person has a cardiac issue and they're obese. So why is that so? Does obesity have something to do with developing cardiovascular issues down the line? Okay, if it does, then how do we stop obesity? What are the social policies? What are the health policies that we can implement? What's the cost of all of this? So medicine focuses on the disease. Public health focuses on sort of the bigger picture, in a more broader perspective. These are very complex terms because they're also used very interchangeably. So
Yeah.
the definition of these terms varies from one person to the next.
Mm.
So if you ask someone else, they might give you a different definition. And if you ask another person, they might give you another definition because these terms are just so broad. And then health IT, again, just by the name, focuses on the information aspect of healthcare. So, health information as in patient demographics, patient medical conditions. We have electronic medical records, so some of the softwares that are used in clinics and hospitals. Health IT also now is starting to incorporate a lot of AI, where we're actually predicting diseases, where we're predicting ER admissions, where we're predicting medical conditions, predicting and projecting hospital or clinical costs. So there's a whole learning element to it too now, and a whole analysis element as well. So these are three key themes now for any pre-med heading into medical school, or anyone I think in the health sector itself, because they really do represent the direction, I'd say, of where medicine's headed for the future.
Yeah, definitely. So I think we'll definitely get back to talking more about the terms and what everything means and how it all connects. But just for this next question, tell us more about yourself. So what about your co-op experiences? I guess maybe it would be helpful for us to say what a co-op is, because I know that's something that's fairly unique, that Waterloo students, that you have to do a co-op. Yeah. And tell us more about the ones you've had specifically.
So co-op in general is just, like it's sort of like an internship that is sponsored by your university. So your university has a platform. They post, and then employers come and they post jobs. You apply via your university to that job. You get selected, and you go to work. So it's basically, so at Waterloo we have a 4-month structure. So every 4 months, you're doing a co-op. Other universities like there's McMaster here. They have an annual thing going where you practice for 12 months straight. So it really varies by university to university, but at least for me in particular at Waterloo, I have 4-month co-ops. And the way it works really is I go for 4 months. A lot of times, or at least what happened to me, is that the employers, they end up liking you and they're like, okay, can you come back for the next term? So at least for me, I did multiple terms at the same employer. But then I guess the flexibility, and I'd say the good part of it, is that you can choose to go to a different employer for your next co-op term. So it gives you that diversity with respect to experience. Yeah.
So even though you've declared a major, you can still kind of explore exactly what you want to do within that. You're not
100%. Yeah.
As soon as
you're not secluded to anything.
Yeah.
100%.
Okay. That makes sense. And then what about your experiences specifically? Because I know you've had some really unique ones.
So initially I started working for the region of Peel here. So this is the area that covers Mississauga, Brampton, and I'm completely blanking right now. Yeah, Mississauga and Brampton. I'm completely blanking. So it's Mississauga, Brampton, and Caledon. No, Caledon. Caledon.
Okay. No worries.
So there's about 2.5 million residents across those 3 cities. I know you must be thinking in the US, man, that's nothing, but for us here, that's a lot. But anyway, so I was in the health policy and the health planning and the health performance department. So I worked very closely with long-term care. I worked closely in planning for health policies, and I worked a lot with regional leadership, particularly in the health sector. So a lot of the people who I worked with were either long-term care or paramedics, really. So a lot of my projects really focused on improving care given to long-term care patients. And a lot of those patients obviously had dementia, and they had multimorbidities such as cardiovascular diseases, diabetes, hypertension, and the list just goes on and on. And then another part of my another one of the cool projects I was able to work on was building a whole EMR system. So at the time, the region of Peel, I think across like 50 clinics, was integrating a whole electronic solution. So I was able to work on the integration of that, and that was a really multifaceted project. I absolutely loved it. Then I came back for another term, and this was basically when the pandemic started. So like 2020
So your
March.
second.
No, sorry.
Okay, and that was
the pandemic started on my first term, but the work was it was kind of weird. So March 2020 was still my first term. The pandemic started, and
Mm-hmm.
after that, I really can't recall what happened because things just went in a blur. There were different things happening every day. Because normally I can tell you what I was working on because it was project based. We were assigned projects, but when
Yeah.
the pandemic started, things were just there as issues popped up. New things just kept on happening. So I remember one of
Mm,
the things I worked on was PPE because you may remember when the pandemic started, there was a huge shortage of PPE, like masks and
definitely.
everything. So I worked
Mm-hmm.
a lot on that with long-term care. We worked a lot on the emergency protocols for staff because I think there were at least about 1,000 employees across the region who were directly impacted. Then we worked on vaccination projects, and then I came back on my subsequent term, and then I worked on a proposal to open an additional respite care facility
Mm,
for patients. So respite care is basically a hybrid between long-term care and a hospital. Respite care is like a short-term stay, and you're getting basically the same treatment as you would in long-term care, but it's just for a shorter time span. And it's normally used for patients in transition. So I was able to lead like a whole policy and research group and um, planning and creating that whole residence. So I really enjoy that. And then after that, I went to a medical device manufacturing company. So they basically
wow.
manufactured.
This is another term. Sorry,
Yeah,
is
this
this
is
like
another
a
term.
third?
Yeah, I'm
Got it.
fast
Okay.
forwarding. So this is another
Okay.
term. Then so they basically made cardiac implants. So they made
Hmm.
stents, they made homografts that would go into your heart after for some sort of surgery. They
Mm-hmm.
made pacemakers and a lot of these things. So over there, I worked closely with the medical director. I did a lot of medical research on how these grafts are made, on some of the patient outcomes, on surgical technique, and then I also helped devise some of the protocols for using those devices. And then
Got it.
it was really really cool stuff. Unfortunately, I can't get too much into it because it's
Hmm.
confidentiality, but just
Of
really cool
course,
stuff.
yeah.
Um, and then throughout this entire process, and even now, I continue to work with a research group called Medical Makers. So these
Hmm.
guys use 3D printed technology and and they use a lot of machine learning and AI for various projects to improve health outcomes, not just here but also in low resource settings. Um, so I can't speak too much about that either, unfortunately.
Sure,
Um,
no, of course. But I
but
mean that does sound really cool, the
oh, it's
mission.
super cool because there's so many
Yeah.
different softwares involved. There's so
Hmm.
many different projects, and there's so many different applications. Applications range from like musculoskeletal disorders to brain disorders to cancers
Wow.
to even
It's a
outer
lot.
space. There's so much
Huh.
stuff that's happening. And I think to be in healthcare in this at this moment is just a very very exciting phenomenon. And then now, actually, next week I start my next co-op at CIHI,
Hmm.
so CIHI, the Canadian Institute of Health Informatics. It's a research and division wing that operates under Health Canada. So
Hmm.
they do a lot of health research, a lot of data analysis, and a lot of the policy recommendations for the federal government.
Got it. Yeah.
So I can't speak to that because I haven't started. But
Yeah.
I guess
Sounds
if you and
cool.
I end up connecting later, I'll let you know.
Sure. Of course. Um,
So that's a rundown of my co-op experiences and whatnot.
yeah, thank you for that. I mean, those all sound incredible, and so cool. Um, let's go a little bit more into the intersection of health information technology and medicine.
Okay.
Because I know you said it's an amazing time to be in this field right now.
Yeah.
How do you think that health information technology connects to medicine, and what kind of potential does it unlock in the future, or even in the
I think
present?
yeah, I think in the present certainly we have some of the technologies we have. Some of them
Mhm.
we're developing. Um, but I think for the future, particularly when we integrate these into the systems, there's a tremendous amount of applications. So we have number one, increased diagnostic capabilities. We have increased screening efficiency. We have more
Mm.
accurate treatment plan devisement. We have a reduction in medication errors. We have reduced visits to the ER. Um,
Yeah.
and 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 we have more accurate cost projections. So for example, I was reading about the Cleveland Clinic a little bit back, and they have their own sort of like an AI-powered hypertension network. And what happens there is that the clinic, they're actually able to predict when a patient who has when they should follow up on a particular patient before their condition aggravates. And this is happening right now. And then as for the future, we have, mobile health technologies. We have predictive data analytics, which a lot of hospitals are, I think, already implementing. And we also have enhanced privacy and security laws, because I understand that that's a main concern for a lot of people. And for the future, now there's a lot of investments that are being made into health security and health privacy that can alleviate some of the concerns that a lot of people have with respect to their personal health information.
Yeah, it's definitely a balancing act in terms of how much patient information to protect while still having enough information to integrate everything and achieve greater efficiency. But I guess that's 100%. A conversation for another time. How about you personally? How do you envision your future at the nexus of those two areas, even though they're very related? So like a doctor working in health IT, maybe you don't have like fully envisioned yet, but what kind of thing do you think you'd be doing?
No, I think you absolutely you spoke it absolutely perfectly. As a physician, I'd want to be on the clinical aspects, but I would also want to be on the frontier of health technology, where I can operate in predicting, and where you can use machine learning and AI to predict health events like health emergencies, health like accurate, and have more accurate diagnosis, develop more enhanced and more effective treatment plans. So I see myself as a mix of both in those places, because I'd really like to bring the clinical to the technological, connect both of those avenues, because I feel really at the rate at which our health technology is advancing, and it's increasing accuracy. There's been some studies I was reading, I think, on some cardiology softwares, where if you give an AI taught bot how to read an ECG graph, it has a 94% accuracy. Cardiologists, a sample of cardiologists had an 89% accuracy. So it's actually more effective than cardiologists who've been reading graphs for more than 15 years of their lives. And that's crazy. Not to say that cardiologists are inferior or that technology is superior. It is a balancing act. And I think that's why we need to further integrate both of these systems. And now we even have telemedicine. I would shamelessly plug one of the ventures I'm working on right now, but I'm not going to do that. If you're a doctor and sitting in Canada, right? I'm sitting in Mississauga, Ontario, Canada. Let's say I'm a doctor. I can see a patient sitting in India right now.
Yeah.
Just the way you and I are speaking. And now there's global telemedicine laws that are coming out that can enable us to do that. We have telerobots where, let's say, and this is I published a paper on this, which is just coming out in the next 2 or 3 weeks. We have telerobotics. If I'm sitting down here at my desk and I have a whole suite of controls in front of me, I can control a robot that can do minor surgical procedures on you sitting in, I don't know, you're in the US somewhere.
Yes, I'm in Pennsylvania.
And I can operate on you in Pennsylvania from here through a robot. Right? That's a huge application.
Right.
And it's actually cheaper than in a hospital setting. And
that's great. I mean, yeah, that leaves so much for, I guess, for you to do. You'll never run out of stuff.
I think for anyone going in the field, you have to do that, because that's an amazing potential of the technology that we have. And I think if you integrate your clinical ability with our rapidly more intelligent technology, there's a lot of great things that can be done.
That's great. I think that was a great answer. And your passion is like extremely evident in what you're doing.
Yeah.
which is a good segue to the next point. What do you think are some of the necessary skills for someone who's looking at this? Maybe they're listening to their talk to this show and they're realizing, oh, this sounds extremely interesting to
Yeah.
me. I guess, what are some of those skills? Although I'm sure you developed the skills during your program, but what would you say to them?
I'd say when it comes to hard skills,
Mm-hmm.
they're very learnable.
Mm.
In particular, or as far as technical skills, so if you want to learn medicine,
Yeah,
go to med school. Like, if you want to
of
learn
course.
health, take some health IT courses. Learn Python, learn data,
Mm-hmm.
learn AI, learn machine learning. You want to choose a specialty in medicine, go to medical school. Work with a local doctor, go to a hospital, do some clinical research. I mean, these are all very learnable skills. I'd say the most important thing, particularly in the medical field, or if anyone's actually interested in medicine, is just having the discipline and
Mm.
the self-regulation to constantly push yourself, because it is a difficult field, and it is a field where there's a lot of competition, and a field where there's a lot of potential. So
Mm.
obviously that requires you to learn as much as you can and also push yourself as much as you can. And I think if someone has that level of discipline and that level of regulation, learning the skills is not the hard part.
Right. But I mean, is it, I guess, do you have to do a lot outside of your courses? Like, do you
Oh
really
yeah,
have to be a
100%.
go-getter? Yeah.
100%, 100%. There's no doubt about it. I mean, your courses will only ever teach you so much.
Right.
And that's not, I'm not talking down on any university, but
No,
it's just
no.
the way things are structured. You
Right.
have to
There's
do
only so
things.
much time in the
Yeah,
course.
exactly.
Yeah.
There's exactly right. So there's and we're living the 21st century. I mean, that type of logic, where I can only learn in school, would have been applicable like 50 or 60 years ago. Now everything's online for a
Uh-huh.
fraction of the cost. So
Yeah.
you can learn things online if you want to gain clinical experiences. Okay, reach out to a hospital, reach out to a researcher, reach out to X, Y, or Z person.
Mm-hmm.
And there's a lot of opportunities available. Now, you might not necessarily be paid for all of them, but the experience is there. So it's really a lot about putting yourself out there and
Mm-hmm.
trying to do as much as you can. But that doesn't necessarily mean that you neglect school altogether. Particularly if you're looking to apply to medical school, you do need to have a good GPA. So you have to balance
Right.
what's
Yeah.
in school and what's out of school. And yeah,
So it's a balancing act. Yeah.
100%.
Yeah. And so that brings us pretty nicely to our last point. Unfortunately, we're out of time, almost, but there is one question we always ask all our speakers. What's your final piece of advice? And I think maybe in this case, because of the audience that we've been talking to, what's your final piece of advice for people who are maybe just about to graduate high school and looking to dive into this type of field?
Just put yourself out there, because there's so many different avenues in healthcare that you don't even know exist, that I don't even know exist.
Hmm.
Just put yourself out there, do different things, try to learn as much as you can, speak to as many people as you can, and then you'll be able to figure out what you like, what you don't like, what you think is right, and what you think isn't. And once you have that level of exposure, you'll make the decision that's right for you.
Right. Okay, great. Yeah. Thank you, Brother Hussain, for coming on the show. Really appreciate it.
No, it was. Thank
And
you for having me, Imran.
of
It
course,
was great speaking to you, and I love some of the work you guys are doing. I think this is a great platform. So all the
thank
best to
you.
you.
Really appreciate it. And obviously, we couldn't do any of it without our speakers. So big thanks to you. Oh, I think the ticker is right there. Your LinkedIn. So
Yeah,
if
the
people, I
LinkedIn.
guess, want
Yeah,
to reach
so
out to you.
yeah, please, guys, if anyone watching this podcast or this interview, this talk show, if you guys want to reach out, you guys can message me on LinkedIn. I'm fairly active, so I'll try my best to get back in time.
Okay, great. Thank you, and take care. Best of luck with everything you do going forward.
All right, thank you, Imran. You as well.
All right.
All right.
Thanks. Inshallah.
Yeah.
And thank you, our listeners, for tuning into the uMentor Talk Show. You can tune into the show next week again for another interview. And remember, you can always catch our previous episodes on YouTube, SoundCloud, Spotify, and Apple Podcasts. Umoja Outreach Foundation, uniting and empowering the Shia community.